At the ninth month of pregnancy, your baby has developed rapidly and is ready to be born. They weigh approximately 3.3 kilograms and measure around 50 centimeters in length. Their lungs have started producing surfactant, a substance that helps expand their air sacs and prepares them for their first breath after birth. This month, you may experience more frequent contractions. These contractions are a sign that your body is preparing for labor. If the contractions become stronger and more frequent, it's best to head to the hospital right away. This month, your baby is about the size of a small watermelon. Their lungs are fully developed and they're ready to be born. However, only about 5% of babies are born on their exact due date. So try to remain calm if your baby doesn't arrive on time or arrives earlier than expected. At the ninth month of pregnancy, your baby's development is complete. You need to be prepared and on standby to head to the hospital if contractions become stronger and more regular. A baby born at 9 months is considered full term because their development is complete. If this is your first pregnancy, at this age, the baby's head is usually in the pelvic cavity and supported by the pelvic bone. However, if this is your second or subsequent pregnancy, the baby's head may not have moved down into the pelvic cavity until labor begins. Most babies at this stage have a full head of hair, approximately 2.5 centimeters long. However, some may have little to no hair. Most of the lanugo, or fine hair that covered the baby's body, has been shed, swallowed, and stored in the baby's intestines. This material will be passed in the baby's first stool, called meconium. The baby's weight will continue to increase to regulate their body temperature after birth. All their organs are fully developed and in place. Your baby can be born at any time this month. The vernix caseosa layer that protects the baby's skin has started to break down, making the amniotic fluid cloudy. The outer layer of skin is peeling off as new skin forms underneath. The lungs are producing more surfactant, a substance that helps the air sacs expand and prepares the baby for their first breath after birth. Your baby has mastered all the skills they need to survive outside the womb. They often suck their thumb, just like they'll search for your nipple to breastfeed. Generally, babies are born around 40 weeks of gestation. Additionally, be prepared for any unexpected twists during labor. For instance, if you plan for a natural birth but end up needing a cesarean section. Ultimately, the most important thing at the ninth month of pregnancy is being on high alert for the arrival of your baby. Regardless of how your pregnancy journey unfolds and how your baby chooses to enter the world, what matters most is the health and safety of both you and your baby, as well as the journey that follows as you raise and nurture your little one.